Hello, my name is Dr. Ibi. I welcome you to this channel, Beyond the Consulting Room. In this video, I want to talk about typhoid infection because there are many people who think they have typhoid infection. They are taking all kinds of medications, but they are wrongly diagnosed. There are three reasons why they can be wrongly diagnosed. The first one is that there are some traditional medicine sellers, some herbal medication sellers who have prepared some medications and have labeled them as typhoid medications. So they give out some symptoms, use typhoid infection to explain a lot of these symptoms, okay? And when people hear them talk about these symptoms as being symptoms of typhoid infection, they go and buy these medications, all right? And they start taking. Many of them come to the hospital, we do some assessment, we do some lab tests, and we realize they don't have any typhoid infection, right? Now, the picture could appear as if there are different kinds of typhoid infections, or there are different versions of typhoid infections out there. The herbal medicine sellers version of typhoid infection, and the typhoid infection as pertains to orthodox practice, okay? But that is not the case. We cannot use one name as typhoid infection to represent different diseases or different infections, okay? There can only be one typhoid infection, all right? A second reason why sometimes people walk around thinking they have typhoid infection, and meanwhile they are wrongly diagnosed, is that the symptoms of typhoid infection look like those of other infections. So you could have somebody who is not well, is feeling ill. You know, we call the typhoid infection typhoid fever or enteric fever. So the person who is feeling feverish, and then there are several explanations for a fever. It can be from malaria, it can be from a urinary tract infection. Sometimes there's some focus of infection like a wound, or from some infection in the respiratory tract, and so on. So there are several reasons a person can feel feverish, okay? So if you don't do a thorough assessment and do proper tests, rule out all these other explanations, you just label somebody as having typhoid infection, and the person actually does not have typhoid infection, okay? The third reason why somebody can have a wrong diagnosis of a typhoid infection is that a popular lab test, all right, or the popular lab tests that are used to diagnose typhoid infection are usually antibody tests, okay? They are tests that are directed towards picking or detecting antibodies of the typhoid organism. A popular one called the Vidal test or the Widal test is known to be quite unreliable, because even when somebody had typhoid infection in the past, and the person antibodies to that past infection is in the person's blood, when you do a typhoid test currently, you will see that the test will show positive, okay, showing, giving the impression that the person has a current infection, okay? But that is a false positive result, because the test has shown that the person has an infection, okay? But in actual facts, that person does not have the typhoid infection or the organism in the blood, okay? So wrong tests, all right, can also show that using the wrong methods of diagnosis can lead to wrong diagnosis. And there are tests that we can use, okay? If you want to make a diagnosis for typhoid infection, you have to consider a lot of parameters and use appropriate tests, okay? But the popular test called the Vidal test can pick past infections, okay? And then we conclude somebody has typhoid infection. Or this Vidal test can even pick antibodies to other organisms which are not the typhoid organism. So we say that it is not very specific for this typhoid infection in such cases, okay? So these are some of the reasons why somebody can have wrong diagnosis of of a typhoid infection. Okay, so that is why in this video I'm talking about typhoid infection, right? So what is typhoid infection? Now, the typhoid infection is caused by a bacterium called the Salmonella typhi, or paratyphi. So we can have Salmonella typhi or paratyphi, but the commonest one we talk about is Salmonella typhi, okay? And it is transmitted through contaminated water and food. So if you take in contaminated food or water, all right, you get infected. Now, this organism multiplies in your gut and then can go into your bloodstream and give you symptoms like a fever. Okay, this fever is like a high grade kind of fever. All right, you can have abdominal pain, diarrhea, or constipation because the infection is happening in your gut as well. All right, now you can have symptoms that look like other infections. Okay, like the vomiting, the headache, the poor appetite. All right, that is why we are cautious to say somebody has typhoid infection without ruling out other explanations. Okay, now if this infection is not properly treated, some people can have complications. So in some cases, even the organism in the blood can travel to the brain to cause some psychiatric like illness. Okay, it's like what we call the typhoid psychosis, and the person can behave aggressively or abnormally. All right, and then it is also possible that because the organism has invaded the walls of the intestine, it can lead to perforation of the intestine. All right, and the contents will ooze out in what we call typhoid perforation. You have to close that hole, okay, surgically. All right, so some people become carriers when they are not, because they have not been properly treated after they got infected. Now, these people, after 6 months of even having the infection, they can still shed the organism or the bacterium in the stool. Okay, so if you do a stool culture, the person has no symptoms, okay, but the person is still shedding the organism in the stool. And these are the people who can easily infect people. Okay, they prepare food for you, you get the food infected. Okay, and that is why in some jurisdiction, people do, when you are testing food vendors, one of the tests they do is test for typhoid. Okay, probably using a stool culture, for instance. Diagnosing typhoid infection by using the lab requires you to isolate the organism in the blood or in the stool. Okay, so the gold standards of the testing is a blood culture, it's a stool culture, and rarely, okay, we use bone marrow aspirates. Okay, however, the antibody test, like the Vidal test and some other antibody tests that are done should be interpreted, okay, properly in a certain context. All right, in order to avoid wrong diagnosis. Okay, now when it comes to treatment, that is very easy. There are antibiotics to treat typhoid infection. The most difficult aspect of typhoid infection issues has to do with diagnosis. All right, prevention, we have said that if you have the organism on your fingers, put them in your mouth, you could get infected. So it is advisable to wash your hands with soap before you eat, soap and water before you eat. There are people who wash their hands with soap and water only after they had eaten in order to clear the smell, okay, from their fingers. All right, but ideally the best time to wash your hands with soap and water is when you're about to eat. And also you have to be mindful of the food you eat, where you buy your food. Okay, that food should be prepared under hygienic conditions, sold under hygienic conditions. Okay, so you must be very mindful of the food that you eat. Okay, now and the water you drink. All right, the source of the water, the source of that food, you must make sure that it can be trusted. Okay, in some jurisdiction they have what we call a typhoid vaccine, but you can't find that in every rejection. So what have I been saying so far? What I've been saying so far is that when it comes to typhoid infection, people make a big deal out of it because you can get tested and it shows positive, okay, using the antibody test. Then we treat you. If you come back again, we test you again, it will show positive. It does not mean you have a current typhoid infection. You have antibodies to typhoid infection, a past infection that has persisted. Okay, so these antibodies keep showing up in your test, but it does not mean that you have typhoid infection. So in order to be sure, we have to use the appropriate testing methods, like the blood culture and the stool culture. Okay, thank you very much for watching this video and subscribe to this channel. Thank you.